Thank you very much. Good afternoon. Thank you for the invitation. I'll try to be quick because there is no much time left. Although I'd like to pose some key messages to you. Maybe my Ukrainian position is not of the greatest importance here. I used to be Deputy Minister of Health in Poland. I spent last year living in Kiev, but right now I'm again in Warsaw, dealing also with health technology assessment, mostly promotion of evidence-based medicine and evidence-based healthcare. And this is the topic of my presentation as we performed a systematic review on most important and widespread methods of nicotine uptake. So on regular cigarettes, on heated products, on e-cigarettes and nicotine pouches. I'd like to refer to the proposition that we shouldn't take into account studies which were sponsored or performed by industry, as well for nicotine products as well as for medicines. I strongly disagree with that. You know, if we stopped pharmaceutical companies from doing and financing studies on medicines, we wouldn't have progress in medicines. We have GCP, good clinical practice principles, and that clearly states what is the role of the sponsor. And the same, I believe, that if you perform registries, you need to cope with good registry practice principles. If you perform, some laboratory tests, if this laboratory is certified, and then you may compare what results are being received by so-called independent laboratories and dependent on industry laboratories. I think that in modern studies there is not much discrepancy with that respect. So I disagree. I think that if the role of sponsors is clearly stated, study is valid, I will take it into account. Nevertheless, look at the Tobacco Productive Directive of the European Union that really points out to the European Union Treaty. And the European Treaty has a very clear provision that all policies, including health policies, should be based on evidence, should be based on valid trials. And I believe that final result, when we get to the laws implemented to European Union member states, I hope that they are going to be well-rooted in valid evidence. What we see, at least in Poland, is there are some Orthodox people. They are really against nicotine uptake, and their opinions are really not based on evidence. I would rather say that they are driven by emotions and some Orthodox approach, rooted on something to fight against. Nevertheless, I believe that, probably you know, that systematic review is on the top of WHO pyramid of evidence. And now, you should also know that currently applied or endorsed tobacco directive of the European Union is outdated. It is based on the trials from 2009, 2014, and these are really mostly observational studies. Even some, let's say, technologies or some interventions which deliver nicotine to the users, they were not even on the market yet. So it is certainly obsolete, and I think that we should negotiate based on evidence its update. And this is actually what is going to happen. Currently, from the 1st January 2025, Poland, Denmark, and Cyprus are going to lead presidency in the European Union. And Danish Minister of Health already has announced that they are going to open up discussions on the tobacco directive. I hope they are going to be based on evidence. And here is my company, I'm the partner there. We perform systematic review of 3 streams, or in 3 dimensions. So chemical, we investigated all clinical evidence available at the moment on chemicals, so toxins, content in the smoke or sachets, and then biomarkers, and then clinical with respect to patient-oriented outcomes. And we have this evidence collected. If you contact me, I have my email address at the end. I will send you that in the English version. All these streams, they aim the same direction, and they prove that there is a continuum of risk. So the worst you can do is to smoke regular cigarettes. Much better it is to have combustible, so heated products, as temperature is lower. But then there is a big gap, and then you have electronic cigarettes, you have non-tobacco pouches, nicotine pouches. In Poland, at least, our politicians don't recognize difference between snus and nicotine pouches. This is a problem, because they don't know that snus is being used in Europe only in Sweden. While you have, in other countries, you have available nicotine pouches with pharmacopoeial clean nicotine. So they don't contain any substances associated with tobacco. Then also in Poland we have a very big problem, because our politicians, they actually aim at protection, mostly youngsters, from initiation of nicotine use, while they forget about smokers and what smoking causes, what are the effects on our health, National Health Fund, on various things around smoking cigarettes, including major risk of highest risk diseases. And I like the harm reduction. Harm reduction, that was definition given here today. It is everything what improves situation of the smoker. So let's not forget about the second goal. And certainly, if you remember the second presentation today, there was a chart like that, where we should all look for optimal regulation. If there is no regulation, it is very bad. But also over-regulating the market, it is very, very bad. And here we have consequences, terrible consequences from over-regulating market in Australia. If you want, again, contact me. I will give you references on that. Wishing politicians evidence-based policy making and finding the optimum of regulation. Thank you for your attention.